Do you ever wonder what it's like to be the Blues team physician on game day? On this episode of The Science of St. Louis Blues Hockey, you're about to find out. This is The Science of St. Louis Blues Hockey.
How would you sum up the role of a team physician?
Certainly the sort of the aura of a hockey team is to be tough. Let me tell you, been around a lot of different athletes from a lot of different sports. They're perhaps the toughest of any athlete I know of. And so our job is to protect them from hurting themselves. I'm Dr. Matt Matava, a professor of orthopedic surgery at Washington University in St. Louis and Barnes Jewish Hospital, and the medical director of the St. Louis Blues. I've been with the St. Louis Blues for 26 years. I followed the Blues my entire life. I used to put number 7 on my skate when I used to skate after Gary Unger.
Unger into the Rocky zone.
I wanted to be a doctor ever since kindergarten, and I played sports in the St. Louis area, so I always wanted to combine my love of science and helping people with sports, and sports medicine seemed like a great opportunity. I think the biggest challenge I have on game day is make sure that I'm on time for everything I need to do. I start off with my normal job, which is being an orthopedic surgeon. I'll start clinic around 7 or 7:30. Hey, Colton, how's it going?
Good, how are you?
Good. Any pain over here? Okay. You were a tender over here last time. And then I do clinic or surgery all day long. And around 5 or so, I'll drive down to the Enterprise Center. During the game, the NHL has a rule that the team physicians have to be within 50 feet of the ice. I might go out and sit in the doctor's seat so I can kind of experience the ambiance of the fans. During the playoffs, there's nothing like that in hockey. I may take the fellows, the residents who are with us, and stand along the glass so they can see up close what happens when a player comes into the glass with a check. If the game went and there's no problems in terms of a medical issue, we'll meet with the players after the game who need to be seen. We'll kind of summarize who's going to have surgery, what tests need to be done, when a player maybe will come back. And that muscle that you strained is right over here. That doesn't bother you at all? That's one of the biggest jobs in sports medicine is to prognosticate the duration of time that it takes for a player to come back. They need to know from a roster standpoint. The fans want to know when a player is going to be ready. We're not always right, but again, we can give them our best guess based on the information we have at the time.
What makes you proud to be a physician for the Blues?
One of the benefits of growing up in St. Louis is being around the team since they were here in the late 60s. I've always been a fan, so past 26 years, getting to be their physician, culminating in staying on the ice when Alex Pietrangelo held the Stanley Cup over his head, you get a little choked up.
And what makes you proud to work at Barnes Jewish Hospital?
You know, as someone who's always interested in sports, basically you'd use the term triple threat. You know, Washington University and Barnes Jewish Hospital is a triple threat in terms of excellence in patient care, excellence in research, and excellence in education. And I think for all my family members, they come here. When I was a little kid, I knew this is where I want to work when I get to be older.
From average Joes to treating the pros, it's all in a day's work for the Washington University physicians at Barnes Jewish Hospital. And that is the science of St. Louis Blues Hockey.